as they dive down. Carla?
Well, Christmas came in November for Colquitt Regional Medical Center as one of their programs received the Gold Seal of Approval. And here to explain what that's all about, I'm talking with Dr. Toman, a board-certified orthopedic surgeon. Good to see you, and Merry Christmas.
Well, thanks, Carl. It's nice to be back.
And this is a big deal for your hosptal.
Well, it is. We're the first hospital basically south of Macon to have this accreditation. It was a lengthy process, but we're certainly very honored to have it, and we hope it really benefits our patient population.
And when you talk about lengthy process, this was a year-long process?
Yes, ma'am, it was. You know, the Joint Commission is the largest accrediting body for medical institutions in America. I think it covers about 20,000. And so when we really decided to expand the work that Colquitt Regional has already done in terms of making care safe and reliable, we said, well, what standard do we want to hold ourselves to? Mm-hmm. And we chose the Joint Commission standard. I don't think any of us knew how much work it would be, but the end product is very exciting for our region.
What was involved, I guess, in the process?
Well, the first thing, the Joint Commission standards are based on consensus national guidelines. They're based on evidence-based practices, but also how the organization functions to implement, evaluate, and change these processes. That all sounds very hand-waving, but the bottom line is we got to remember, total joint replacement is an elective procedure. Mm-hmm. It's for people's quality of life. And our opinion was anything we can do to make it a safer and more reliable procedure, we should be doing, you know, just like all the big centers up north.
All right, so what would you tell me, or what can you tell me about the joint replacement program at Colquitt Regional?
Well, we have a very standardized and robust program at this point. Before this, you know, a lot of people thought about joint replacement as some type of magic that the surgeon does in the OR, and that's what people were really focusing on. But really, we're trying to make it more of a standardized process, emphasizing more the prehab or the pre-surgical optimization in terms of getting us the best post-surgical results. Mm-hmm. And, you know, the multidisciplinary approach that we've taken, you know, it wasn't just me and a couple nurses sitting down. It was pharmacy, it was the business office, it was physical therapy. I mean, everyone who touches our total joint patients was involved in making this a success.
All right, so when somebody comes to you and they say, oh, my gosh, my joints are aching, they're hurting me, well, what do you normally say to them? I mean, what is the process before you get to surgery?
Joint replacement, got to remember, surgery is controlled damage to your body in hopes of making you better. Mm-hmm. So I think you need to maximize non-operative therapy before you think about taking that step. But it's highly personalized. You know, there's some of these old farmers who are walking around with horrible arthritis, and they just want to get back to work, and they just want a shot. And then there are some folks that are very young, and we've tried everything we can think of to make them better, and we just can't get out of the option of changing the anatomy of that joint. So I don't think there's a one-size-fits-all, and that's why it's a really important thing to have a good dialogue with your provider and trust that that provider is going to listen to what you're telling them.
So you're talking all ages?
All ages, yes, ma'am.
Athletic injuries, possibly?
Well, hopefully not athletic injuries after a one-off basis. But, you know, I was in the military. I was up in D.C. You know, we saw a lot of people wounded downrange, mm-hmm. young athletic people in their 30s having to undergo total joints. And, again, they made the assessment for themselves that having this procedure would make their lives better.
All right, and also when we talk about the joints, we're talking, what, hip,
yes,
knee, other joints?
Right now, hip and knee. Those
are the most common?
Yes, ma'am.
Okay, and again, is something else you need to tell us about this program? Of course, again, you received your confirmation in November, and we're talking total knee replacements, total hip replacements, receiving the Gold Seal of Approval. Mm-hmm. That, as we said, that is a big deal, especially for South Georgia.
Well, we're the only hospital with that accreditation. And, you know, there's a lot of insurance companies that have their own in-house versions of this, mm-hmm. but really they're just looking at claims data, surveying providers. This is a rigorous process. We had multiple on-site visits. They really drilled down, and I think our patients are going to see a big difference.
And one little extra, you received a hospital safety score. An A, was it?
Yes, ma'am. Fourth year in a row. It's just part of our ongoing initiative to make, you know, care in this part of the country better. You know, there's a medical school coming to the region. We're a member of the American Joint Replacement Registry. I mean, there's a lot of exciting things happening here that I think our patients are going to look forward to.
All right, and if you want more information, I've got the number, 229-785-2400. Congratulations, and once again, Merry Christmas.
Thank you, ma'am. You too.
Stay with us, everybody. We've got more for you after the break.